Good day, everyone. My name is Washifa Isaacs. I'm the Notifiable Medical Conditions Coordinator for the Western Cape. So I have to ensure that all doctors, all nurses, all lab staff, public and private, adhere to protocol, standard operating procedure, as well as government gazette with regards to notifiable medical conditions. Today, we're going to start with an introduction, as well as registration and password resetting for mobile app devices. Our objectives will be introduction, One Health, NMC regulations, list of category 1 NMCs, list of category 2 NMCs, your list of category 3 NMCs, list of category 4 NMCs, access to NMC mobile app, responsibilities and misconceptions, your NMC electronic system benefits, how to access and install the NMC app on Android devices, registration process, facility-based, role-based, private practices, and password resetting, and then how to log out. So an introduction to notifiable medical conditions. The National Health Act of 2003 was amended in 2017. It provides details of the legal requirement for surveillance of notifiable medical conditions in South Africa in line with international health regulations. Every doctor or nurse who diagnoses or treats a patient with any NMC should notify the patient on time. Notifications provide empirical data required to monitor disease epidemiology and inform on policy and planning. A One Health approach in South Africa. So Africa Centers for Disease Control and Prevention embraces a transdisciplinary One Health approach to making Africa safer and healthier for humans, animals, plants, and their shared environment. So what are notifiable medical conditions? There are diseases that are of public health importance because it has a potential to cause an outbreak, an epidemic, or a pandemic with usually high case fatalities both nationally as well as internationally. So on the screen, we've got Ebola, measles, malaria, and cholera, and those all form part of your category 1 NMCs. Why do you have to do the notification? It's to prevent the disease from spreading any further, detect and notify on time, respond with action. And with that, we mean you have to treat your patient, isolate your patient, as well as reach out to all the close and vulnerable contacts. And those are also persons who have not worn their proper PPE. And please do not forget about the cleaners. Your NMC regulations, it starts off with International Health Regulation of 2005, and that is also for border control and trading. Your Global Health Security Agenda, and that forms part of the Centers for Disease Control and Prevention of Communicable Diseases, your National Health Act 61 of 2003. And within that, we have a framework for structure and uniformity within the healthcare for RSA, your NMC Surveillance and Control Regulations of 2017, and that we have extrapolated directly from the Government Gazette. Who should notify? So any healthcare provider who makes a diagnosis of any NMC, so that will be your doctor, your nurses, clinical associates, and within that we have doctors and nurses forming part of either an NGO or any other non-NGO or any other research project, and also all your laboratory staff. Failure to notify, however, is a criminal offence, and there is a jail term of not exceeding 10 years imprisonment, and that will be determined by a court of law as well as your practice body, SANG for nurses or HPCSA for doctors. Your NMC categories, so it starts with category 1, that has to be notified within a 24-hour period. Category 2, within a 7-day period. You do not have to wait for a lab report to confirm that it is an NMC. The minute you have enough clinical evidence and you've made a unanimous decision with your clinical team, infectious diseases specialist, you go ahead and do the notification on the app. We also have category 3 and 4. Doctors and nurses, however, they have to concentrate and notify only category 1 and category 2. Category 3 and 4, you have to treat your patient. If it needs isolation, you isolate your patient. You also have to reach out to close and vulnerable contacts with regards to the post-exposure chemoprophylaxis. Also reach out to your environmental health practitioner where need be, so that they can ensure that there is follow-up of your, if it's persons, if it's animals or the environment to ensure we have a One Health approach again. Your laboratory, however, has to notify all 4 categories. So what they do is they bring it to your attention as soon as a specimen that you have sent off to the lab for an NMC testing. As soon as it becomes positive for that notifiable medical condition, they will then send you a report. So because we are leveraging onto the NHLS's lab system, those reports will filter into our data mart on the NMC app, already into your cases, which I will show later. So your lab then only pushes back to you the demographic information as well as what pathogen was isolated. They do not do any clinical notification. The clinical notification component, it stays and it will be your, as the clinician's, responsibility. Category 1, this is the list of your Category 1 notifiable medical conditions. We do offer another training where you will be able to know all the case definitions, but for now, I'm just going to go through the ones which require an EPID number. So acute flaccid paralysis, that goes hand in hand with polio. We are trying to keep South Africa a polio-free country. So you require an EPID number to go onto your request form to the lab, as well as a case investigation form and also a neurological assessment form. So that is in addition to doing your notification on the app. Do not forget about your stool samples, 24 to 48 hours apart, to be kept cold, and send that off to the lab with your EPID number and your case investigation form. With measles, you also require an EPID number. So on your blood request form, you have to put that EPID number, and you also have to complete a case investigation form and also put the EPID number there. And if your patient should test positive for rubella, although you have sent it off for measles, they do test for measles as well as rubella IgM, then please complete a combined measles and rubella case investigation form. If it's just measles, then complete the case investigation form for measles only. So those all form part of your expanded program for immunization, including your pertussis. Please ensure that you always check the last date of vaccination, as well as do all the follow-up, catch-up vaccines for children especially, and also if there are any close contacts, vulnerable people, to also ensure that they get the vaccines and any other post-exposure chemoprophylaxis. So category 2, that is the list. And remember, we said it has to be notified within a 7-day period. For most of these, you will already have a lab report. In that case, if you are working in a public sector, the report will already go to the NMC under cases for you to do a clinical notification by editing the report, which the lab has sent you. But if you look at agricultural or stock remedy poisoning, please involve your environmental health practitioner, and all poisons are listed under that heading, please. Pesticides, rodenticides, insecticides, and all herbicides, any kind of cockroach mixture or any kind of mixture. So it could be that the person was intentionally harmed with a poison or unintentionally. Your environmental health practitioner will play a pivotal role, and also if, however, it is intentional, then SAPS will be involved. And please request a report back from the EHP as well as SAPS and send that back to the Department of Health. So for all conditions, if you have report back of the close contacts that you have followed up, if you have report back from the environmental health practitioner, to ensure that the CDC in the Provincial Health Department, that is your focal person for the province, as well as your district focal person, your sub-district focal person, as well as national. Make sure it reaches all focal persons, your feedback reports, your follow-up reports, please. Also to note that hepatitis A, you do need a case investigation form in addition to your notification. And also environmental health practitioner is involved to do the follow-up. So you send your case investigation form to your environmental health practitioner. They will have access to the NMC on the app. All your TBs are notifiable from a hospital setting within the Western Cape, from a hospital setting. If you make the diagnosis of a TB, any TB, pulmonary, extrapulmonary, multi-drug resistant or extensively drug resistant XDR-TB, then from a hospital setting, you have to do the notification there. Category 3, that is your list. So remember, we said you treat your patient. If it needs isolation, you isolate your patient, and you also reach out to the environmental health practitioner or anybody who has to do the follow-up to ensure that your patient, maybe your patient has been already discharged, so ensure that your patient is treated and that there is some kind of follow-up feedback done, especially with if there should be a salmonella or dengue fever virus, that would need a sample. For example, salmonella is typhi, Salmonella typhi or Salmonella paratyphi, that's category 3. But to ensure that there is follow-up, environmental health practitioner needs to do maybe water testing. Category 4, this is also notifiable by the lab only, but you need to see that your patient is treated and followed up. Access to your mobile NMC app. You download the app from a Play Store or App Store. It's also available on your Huawei app gallery, your Apple iStore, so all iPads, iPods, any iPhones. We also have reverse billing, and it is applicable to use on the app after you download it with no charge. If a user wants to do a self-registration, ensure that they have a valid SANC and HPCSA number to do that registration, and also your South African ID number or passport number, and also an active email account. You are able to use your work or personal email. It does not matter. NMC electronic system, the benefits we have, there's real-time notification. So everyone who's on the app will get an alert either via SMS or via an email. It depends what notification preference you have selected from your profile on the app. There's also direct data entry. An SMS alert, as I said, will be sent, but remember, for category 1 conditions only, except for COVID-19. We mentioned before the NICD leverages onto the NHLS's lab system, so all lab data will feed through the NMC data mart morning and evening as specimens become positive for the notifiable medical condition. Data will be sent when a case is captured on the app by your healthcare provider, or if you are making use of a data capturer. A data capturer is allowed to do notifications on the app under strict jurisdiction from the registered nurse or the practicing doctor. Responsibilities. We also have some misconceptions. So both the lab and the clinician have a responsibility to notify. But the above does not duplicate your notifications. Your lab notifications are reported on a different platform and then sent to the NMC surveillance system. And then we also have the application programming interface to ensure that the data actually filters through to reach you onto cases and for you to do your editing of your clinical data. Clinical notifications provide detailed information such as comorbidities and patient outcomes. How to access and install the app. You go to your Play Store on your smartphone, type NMC app on your search bar. It will be the one at the bottom. Click on NMC reporting and install the app. And once you have it installed, from time to time, just like any other app, it will ask you to do an update. So ensure you have the correct version. The training objective now will be registration process for facility-based users. Your registration, previously registered on the NMC app, You enter your username, then you click Forgot Password. If you have not used the app for more than 12 months, please re-register. So let's assume you are a new user, so you can click onto Register. Once you click that, you will go over to the registration personal details page, and it requires you to complete all your personal details. Just follow all the variables from the top to the right, from the left to the right top section, and go down to the bottom. You will also be required to put in it will ask you for your practice details, which is your practice body. And when you drop that down, you will find SANC and HPCSA. If you are, however, a information manager or an admin clerk, just say not applicable, and it will grey out the area which asks for a practice number. If it is a clinician and you've selected your practice body, then your practice number will be your HPCSA number or your SANC number. If you are not a private practice, you're going to click onto No and go onto Next. Your linking type will be for persons who are working at 1 to 5 facilities. It will be a facility-based linking type. Let's assume that is what you have selected. So facility-based registration, you can select up to 5 facilities. It can also be a mix of private and public facilities. It can be clinics and hospitals. So your neighboring clinic or neighboring hospital to where you actually are working is often useful. And then once you have selected your district, and your sub-district will be where your facility is. If you know your sub-district, your facility should show in the facility drop-down menu. So make a selection and click on Add Facility. And once you are done, you go on to the next section. It will be your terms and conditions. You read and accept your terms and conditions, which will read around all your confidentiality and privacy issues surrounding all the information that you will be exposed to, and click on to Register. A confirmation of registration will be sent to you via SMS, and once that's done, you can click on OK. Authorization will be done by the Provincial NMC Coordinator. An SMS or email will be sent to you, and that will detail your username and your password. Now, the registration process for a role-based user. A role-based user is a person who is having more than 5 facilities, overseeing a sub-district, a district, a province, or national. So you can make a selection from the level drop-down menu. Once you've made that selection, it will then ask you which role would you like. So from the drop-down menu, I would prefer you to select infection prevention and control. That will also give you editing rights. Once done, you can click onto I have read and accepted your terms and conditions, and click onto Register. A confirmation of registration will be sent to you again, and authorization will be done by the NMC coordinator. An SMS and email, or an email will be sent to you with your login details, so that will be your username and your password. If you are working in a private practice, this is what has to be done. Private practice registration. It will first ask you, are you a private practice? You're going to click onto Yes. Once done, if the facility is not on the list that we have once you drop it down, click the tick box. Once you click the tick box, it will allow you to put in your facility name and your facility details, contact details, and the street address. Once you are done with that, you can complete the facility-based details and click onto your terms and conditions, and then click onto Register. A confirmation again will be sent to you if it is successful with your username and your password, and the NMC coordinator will do the authorization. If you need to reset your password because you had forgotten your password, or you are moving over from when we had the older app to the new app. You can put in your username, which is your South African ID number, or your email address, which you have provided us with when you registered. Then click on to Forgot Password. Type your ID number in to verify that it is you and click on to Next. A one-time password will be sent to you via SMS. Please put that in immediately and reset your password. If you lag, the time will expire and you won't be allowed for 15 minutes to do another resetting of your password or requesting an OTP. If you are creating a password, then your password requirements will be, you need to have 8 characters, at least an uppercase, lowercase, special character, as well as some numerics. So if I take part of my name, for example, I can say wash at 1, 2, 3, 4, with a W being a capital letter. That is considered a strong password. Make it simple and also try to write it somewhere safe so that you can always readily retrieve it. Click on Reset, then OK. And once you do that, an SMS or email will follow. And then it will say that your password was successfully reset. Thank you. If you need my details, I have them available. You can call me or WhatsApp me on 064 742 4005. Or if I'm not available, you can call on the hotline at 072 621 3805. Thank you.